Clavicle, take one.
Okay, the clavicle.
I can get you a better one.
The clavicle, the round. Wait, this is the front, right? Can you stop it, please?
Okay, clavicle, start, take two.
You have a sternal end.
Is it left or right?
This is a left clavicle.
How do you know?
You know because first of all, your sternal end is the round one. So sternal end of the left clavicle. And then you have your acromial end of the left clavicle, and you have the shaft of the clavicle. You know it's left because first of all, this is superior, because if you look at the bottom, there's a lot of ridges, so that's the inferior. So now that you've established that, you know that this is left because it's more convex at the sternal end, facing anteriorly, and then it's more concave at the acromial end, facing anteriorly. See it? So this one attaches to the sternum, this attaches to the acromial process of the scapula. So here we have a left scapula. It's going to fit like so. Okay? So left clavicle, left scapula. Moving on to the scapula. As we already distinguished, this is left. The glenoid fossa right here.
How did you distinguish?
The glenoid fossa is always pointing outwards, okay? So laterally. And then the spine of the scapula is always posterior. So anteriorly we have the subscapular fossa.
Yes.
You have the subscapular fossa. You have your coracoid process. Like we mentioned earlier, you have your glenoid fossa. On top of that is the supraglenoid tubercle of the glenoid fossa of the left scapula. And then below it, we have the inferior glenoid tubercle of the glenoid fossa of the left scapula, right here. So you have your superior and your inferior. Okay, in the back, we have the spine of the scapula. This is the apex or root of the spine of the left scapula.
There you go.
And then right here is your acromial process.
Yeah.
Acromion process. And right on top, we have our supraspinous fossa. On the bottom, the infraspinous fossa. On the top right here is our superior rangule. On the bottom is the inferior rangule. The top border is the anterior border. Superior border of the left scapula. You have your medial border of the left scapula. Okay, so this is the front. Your medial border of the left scapula. Your lateral border of the left scapula. Anything else?
No, that's it.
And that's it for the clavicle and scapula.